Joining me now in Washington with me at Storm Center 1 here is Kavita Patel. She's a practicing physician with Johns Hopkins Medicine and a fellow at the Brookings Institution. She was instrumental in the development of Obamacare. Also, John C. Goodman, senior fellow with the Independent Institute and president of the Goodman Institute for Public Policy Research. Andy Slavitt, former head of the Centers of Medicare and Medicaid under President Obama. So a whole bunch of people here who know a lot about this topic. Thank you for joining us. Kavita, let me start with you. You've watched the changes that have happened to try and do more, to try and get this bill passed. It didn't seem to change the whip count on how this is going to go. What's your sense of the best thing to happen right now?
So the best thing, if you're a Republican, the best thing to happen would be that you can at least say to people, look, this is just to get us through the House. We're going to still be working on this. Remember, it's a long process. They still have to get it through the Senate side, then a committee, and that you'll continue to work on this. If you're a Democrat, you're hoping that you're still 9 votes short and that this fails and that we still have the Affordable Care Act as pretty much still the law of the land.
Which is what President Trump has sort of implied is going to happen. John, a new score from the Congressional Budget Office last night, which is, by the way, not about the changes that were made last night. This is about the last set of changes. Interesting result. It shows that basically no change in the number of people who will have coverage versus the first draft, but less of an impact on the deficit. In fact, less of a reduction in the deficit. In the original bill, $337 billion deficit reduction. In this new bill, $150 billion. Does this help or hurt the efforts to get this bill passed?
Well, the big mistake that the Republicans made was they are repealing $1 trillion in Obamacare taxes. And this includes taxes on drug companies and insurance companies. And those are special interests who agreed to be taxed in order to have health reform. They're not even asking for their money back, and yet the Republicans are insisting that they take the money back. And when you give away $1 trillion, you have less money to insure people, and that's why the CBO is saying there will be 14 million people without health insurance. That's not what I think Republican voters have really been asking for.
Well, what do you think they've been asking for? Because that's, I think, what the complexity here. There's a lot of people who say that the one thing that Republican voters were promised is a repeal of Obamacare, and that's what they're trying to get done. But I think there seems to be a shift in sentiment here about a bunch of people who don't actually want more expensive health care, worse health care, or nothing in its place.
Obamacare allowed millions of people to be dumped into the individual market. It was a market that's working reasonably well. And people who are in that market have seen their premiums double and triple and their benefits cut. And they're very angry about that, and they have a right to be angry because they're being forced to pay the price of health reform for the country as a whole. So there was an opportunity for Republicans to show they could do a better job of this, and so far they haven't shown that.
No, they haven't. That's the problem. Andy, Health and Human Services Secretary Tom Price says there's way too much focus on what's not in the bill. Everybody's looking at what's not in it as opposed to what may come later. Listen to what he said on Morning Joe.
That is part of a plan, and that's why it's so important to appreciate that there's so many other things that are going on in the area of health care to make certain that we move in that direction of patient-centered health care.
Andy, I mean, it is kind of hard. There's actually no bill for most people to see. There were changes made last night. There hasn't been good review of this. The groups who have interests in this have not been represented. So it's a bit of a hard sell to say go with this, repeal Obamacare, but much better stuff is coming later.
Right. It's a really tough vote for them to ask rank and file Republicans to take. 55,000 people in the average congressional district are going to lose coverage. Premiums are supposed to spike 15 to 20% above current levels. Now they're talking about taking away things like mental health and other protections in the bill. And when they say, hey, don't focus on this bill, there'll be other bills to follow, it reminds me of when my kid would come home from school and say, you know what, Dad, I didn't get a good grade on this test, but don't worry, I'm going to get an A in this class because I think there's going to be other tests.
Now that you remember that, I did that all the time. John, let me just ask you something. The argument you just made, and many Republicans make, is that people's premiums went up a great deal in the market as a result of Obamacare. But in fact, when you look overall, when we don't cherry pick stuff, the rate of increase was slower over the last 5 years than it was over the 5 years that preceded this. Insurance rates go up all the time. I don't remember any time that they haven't gone up. What remedy should Republicans offer rather than saying that insurance rates are going down, because they're not?
Well, premiums went up about 60% on average for about everybody who's been in the individual market, and for some, of course, much more than that. And the reason is because they allowed the risk pools to dump their sick people into this market, and they allowed the city of Detroit to dump 8,000 people into this market, and none of those people are paying a premium.
Let me just stop you there, because that's exactly the topic I want to get in. How do you do this without creating a bigger risk pool?
Well, you don't allow these outside groups to dump sick, costly patients into this tiny little market and expect the people in that market to bear the full cost. So that's a huge, huge mistake, a bad way to reform health care. I helped Pete Sessions and Bill Cassidy with a health reform that would have reformed the entire health care system, and we would have treated everybody the same, whether they were in the individual market or the group market.
Well, so, Kavita, I want to bring you in. I sort of think that John's talking about stuff that I like to talk about all the time. Create a bigger market, the biggest risk pool you could possibly get. Not a bunch of state markets, not an employer market versus an individual market, but how about everybody in the same market? And that way, I mean, every other OECD country has done this and rates are lower.
Right, that's correct. And so this is just insurance 101. You create a larger risk pool and you basically spread that risk across a much larger population, not just an individual market. Remember, this part of what's been delayed in Obamacare has also been the employer mandate. So the idea is to get to a place where you have a much larger risk pool. And we were actually thinking about doing that with a public option. If you'll remember,
right.
The House actually had a public option, and then because of some of the differences, we used the Senate version, which did not have it. But that would create a bigger risk pool and bring costs down.
And some people have been asking for that. John, Andy, Kavita, thanks very much for joining me on this, and thank you for sitting here during this little weather incident we're having.